Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward, and thank you so much for joining us today for another health ministry update. I felt like we needed to just inform you of all of the activity that's been going on and just make sure that things were clear with respect to what has happened and what will be happening over the coming weeks to months. So, let's not get it twisted. The emphasis remains on getting the unvaccinated vaccinated. That's our best way to fight COVID-19 right now. In the meantime, we're still doing hand washing, wearing masks, and social distancing. But vaccination is the most important thing that we have to prevent severe illness, hospitalization, and death. The vaccines are working, and people have really done well who've been vaccinated. There have been a few that have gotten infections, and we're saying breakthrough infections, but that's actually a misnomer. We never said or never intended to imply that you would not get an infection. The vaccines were developed primarily to prevent hospitalization, severe illness, ventilator support, and death. So, the Pfizer Biontic vaccine is what we're going to be talking about today. The vaccine was approved by the FDA. It got past the emergency release authorization and is now approved as an official drug of the FDA. In the last week, the vaccine was approved as a booster, the Pfizer Biontic booster. So it is now approved for emergency use authorization as a booster shot. And that booster shot is going to be the same injection, the same vaccine, the same ingredients in the same dose that we had with shot 1 and shot 2. So when do you take it if you need it? If you have had shot 1 and shot 2 6 months or more ago, then you may be eligible for the Pfizer booster. The Moderna and J&J do not apply here. So those of you who've had Moderna and J&J, you will hear more about that later. They have, I believe, requested emergency use authorization. If they haven't, that will be coming down the pike soon. I do know that Moderna has been working on a booster, and it will likely have a lower dose. It won't be as much of the vaccine as what was given originally. That we will see in the near future. It's not clear whether mixing the vaccines will be an issue or not. Trials and studies are being done at this time to determine if you can mix the vaccines. At this point, we've been trying to use the same vaccine that you got with your first injection. So if you got Pfizer, we used Pfizer for number 2 and would expect to use Pfizer for number 3. And same with Moderna and J&J. You'd use the same vaccine, but they're trying to see if it makes a difference, if there's a problem with mixing the brands of vaccines. Who gets the shot? Those aged 65 and older, those aged 18 and older with underlying medical conditions, and I'll go through those, all of them. Those aged 50 to 64 with underlying medical conditions, and those 18 and older in long-term care facilities. Now, there's some people age 18 to 49 who may not have underlying medical conditions, which means that the risk is not as great. You can talk with your doctor about getting the booster. But just about everybody else, it's recommended that the booster be given, especially if you are age 50 and over with underlying medical conditions. One other thing I needed to tell you about the Pfizer vaccine: when you go to get your booster, you need to have your card. And it's very important that you request your card before you go if you can. There's 3 ways that I'm going to tell you that you can request your card if you don't have yours, if it's lost or whatever. Number 1, Lentz Public Health Center, 2nd floor. Go there to request it. You can put in your browser on your computer the Tennessee Immunization Information System, Tennessee IIS, Tennessee Immunization Information System. And thirdly, you can put in the COVID-19 immunization record request. Both of those will take you to a site where you can apply or request another card. So the other group of people are those who have occupations that put them at greater risk. And those people include healthcare workers, first responders, people who work in schools, such as the teachers, people who work in correctional facilities, and those in homeless shelters. The risk of exposure is so much greater that these people, age 18 to 64, who work in these environments, are recommended to get a shot. If you're 65 and older, it's recommended that you get one regardless. So, the underlying medical conditions, let's just go through the list right quick. They include cancer, chronic kidney disease, chronic lung disease, which includes asthma, emphysema, or COPD, cystic fibrosis, things like that, dementia and other neurologic disorders, diabetes, type 1 or type 2, Down syndrome, heart conditions, HIV, immunocompromised conditions from other reasons, which may be genetic or acquired from chronic steroid therapy or other medicines that are used to treat diseases that weaken the immune system. Liver disease, overweight or obesity, pregnancy, sickle cell disease, thalassemia, cigarette smoking, vaping, anything that might harm your lungs, transplant, whether it's a solid organ like kidney or a blood stem cell transplant, stroke, and substance abuse disorders. Those are the things that are called underlying conditions that put you at greater risk for developing severe disease from COVID-19 and would require that you consider getting a booster if you've had shot 1 and 2 6 months ago. The other thing I wanted to mention before we go is that if you are fully vaccinated and you had COVID-19 after you were fully vaccinated, you may not need the booster because the infection after you were vaccinated may actually have counted as a booster for you. So talk with your doctor about that situation if that includes you. The other thing is we've been saying breakthrough infections, and I want to just comment again on that briefly. That's a misnomer. The vaccines were never intended so that we would not get an infection at all. They were intended to protect us from severe disease, hospitalization, ventilator use, and death. So it's not really a breakthrough infection, but it is an infection with COVID-19 that we get that's usually milder if we've been vaccinated. So I just want to make sure that we understand that. The vaccines are working. There's no question about that. At any rate, if you have questions or if there's anything else we can help you with, let us know. You can reach us at the church office, or you can reach us on the church website at lpmbc.org, or you can reach us through our Facebook page, LPMBC Nashville Health. And by the way, we try and keep that up to date so that there's information that you can use that is constantly updated frequently. Thank you again for joining us. As always, stay safe, stay healthy, and stay prayed up.